I'm Rick McGuire. I'm the executive editor of CardioSource World News, and I'm with Greg Fonarow from UCLA. We're talking about a state-of-the-art paper from Jack on home monitoring for heart failure management. Thank you for a few minutes of your time. Home monitoring is very important. We've got a lot of heart failure patients. In this particular state-of-the-art paper, what are you focusing on?
So we're really focusing on the strategies and techniques that have been utilized to try and reduce the morbidity and mortality for patients with heart failure. There are over 6 million patients with heart failure, over 1 million hospitalizations occur a year. These patients can frequently decompensate, and there have been a variety of different strategies attempted to be utilized to try and prevent hospitalizations from occurring and enhancing the management of these patients in the home environment. So in this review, we really looked at all of the literature that had been published and which of those strategies may or may not be effective to try and have a meaningful impact.
And that's important because, as I recall the data, they really stretch across the plane in terms of effectiveness. Some seem to work, some don't. In terms of describing telemonitoring that works, what would you say today works?
So for home monitoring, of which telemonitoring is one component, and I think it's really important to recognize there are other strategies that have been utilized, disease management programs, home visits by actual clinicians, and then some advanced technology. Telemonitoring has gotten a lot of attention, and in fact, in some of the early studies that tended to be single-center studies describing a large impact of the intervention, being able to markedly reduce hospitalizations through the home monitoring techniques. More recently, though, there have been a number of multi-center trials that have tried to scale up the intervention. And it's been a real surprise that the two largest trials recently presented, TELE-HF and TIMS-HF, had no meaningful impact on reducing hospitalization or mortality. So it really tells us the type of intervention matters, that maybe some of the early single-center studies were giving us the idea that there's a larger impact that can be achieved. But it also focuses on the fact that just having additional information, if it's not acted on in a timely fashion by clinicians that truly understand that patient and how to intervene in a way that's going to help achieve and maintain compensation in that patient, that the intervention truly may not be beneficial. We also recognize there's some limitations. If you wait for heart failure symptoms to develop or just even monitoring of daily weights, that isn't very sensitive in picking up decompensation, nor specific, so you get a lot of noise in the background. So we've really seen that, there isn't a simple telemanagement solution that's yet to be identified.
Does the patient choice matter? Who you choose to use home monitoring on? Is it at all like stents, where we now realize that before you place a stent, think about, is that bare metal stent what you're going to use or a drug-eluting stent, because will that patient adhere to a dual antiplatelet therapy? In home monitoring, is there an adherence issue that comes into play when you're deciding which patients to put onto home monitoring of some kind?
So it's a great question, this issue of patient selection. Certainly adherence. In some of these studies with telemonitoring, you saw situations where the patients got tired of it, agreed to enroll, did a little initial telemonitoring and stopped answering phone calls, and stopped using the telemonitoring. So adherence may be important, but even when you looked at patients that were persistent in adhering to the intervention, there wasn't necessarily a large effect. So part of it is, I think, needing better information to rely on. And we have seen with some newer technology that we may be on the cusp of actually having effective ways of managing patients in the home environment, taking advantage of implantable hemodynamic sensors where that data kit that's reliable, that's actionable, can then be rapidly interpreted by the clinician, instructions provided to the patient, and reductions in hospitalizations observed.
In the state-of-the-art article in Jack, do you offer any advice to clinicians who are considering using more home monitoring?
So we certainly do. We take the realistic approach. We recognize these are patients that are often older, may have cognitive impairment. There's certainly adherence issues. There are multiple comorbid conditions. But we have seen situations where dedicated heart failure disease management programs or monitoring is offered by advanced practice nurses and heart failure experts, there have truly been beneficial reductions in morbidity and mortality seen. We talk about the importance of the timeliness of the information exchange and truly actionable data that's reliable, ways of enhancing patient adherence, and really avenues that are necessary to go forward in studying this problem and challenge, in a much more rigorous fashion. So we can define the most optimal interventions, define the most optimal patients who will benefit from those interventions, and really the highest value approaches where you get the greatest cost effectiveness. One could speculate all heart failure patients are at high enough risk and should have more intensive home monitoring. Others would speculate, given the cost of an intervention, that we could better target those patients at highest risk for hospitalization or mortality to be the group that we focus in on. So there are some practical approaches that are discussed, but also recognizing there's not one size fits all and more research is clearly necessary.
But there's enough right now that it can be used effectively with the right patient and the right technology today.
So there are certain strategies that are achievable right now and have been shown to improve the rates of hospitalization, and there is a very promising technology that is before the FDA and hopefully will become clinically approved, that of implantable hemodynamic sensors linked to heart failure disease management, that in the CHAMPION study lowered the rates of hospitalizations by 30 to 40%, a very sizable impact up and beyond the standard of heart failure disease management and care. So that may be a true game changer, one that's not available right at the moment, but hopefully will be available soon, and that we will be able to apply to those patients already shown to benefit and further study in a broader cohort of heart failure patients to define additional populations that benefit, as well as study the practical implementation. Can you move beyond heart failure experts and have general cardiologists also managing this data, or even primary care physicians, since there are a relatively limited number of heart failure experts?
Right. We encourage you to go and look at the state-of-the-art paper in JAC by Dr. Fonarow and colleagues, Home Monitoring for Heart Failure Management. It's in the January 10th issue of the Journal of the American College of Cardiology. For CardioSource World News, I'm Rick McGuire.